Good morning, everyone. Thank you so much for joining us today. We wanted to give each provider community an opportunity to talk to us about some of the federal authorities that we have been given during this crisis with COVID-19. And give you a chance to ask questions and make sure that we have not missed anything that you might need as a provider community from the Healthcare Authority. Hand it off to Traylor, and he's going to go through what we've done so far.
Hi, again, thanks everyone for joining us today. Just kind of want to give a brief overview of where we stand. If you don't know who I am, I'm Traylor Raines, Deputy State Medicaid Director for the Oklahoma Healthcare Authority. And we also have Dana Miller and Latrita Bradford, and I think Johnny Johnson on with us today as well. And we will look to them to respond to direct questions if they're outside of mine and Mel's scope. So I did want to give you an update. The Healthcare Authority did apply for and received approval for an 1135 emergency waiver through CMS. What this does is give us certain flexibilities that we couldn't have previously done in providing services and provider reimbursement through our current federal authorities. It was in effect, our flexibilities, a lot of them, we got authority back to March 1st. We've slowly phased in the flexibilities. For instance, you've probably seen global updates on our webpage about the expanded use of telehealth. So we pretty much, most sooner care reimbursable codes now can be covered by telehealth. Telehealth, as a reminder, is defined as two-way interactive audio-visual. So you can use a platform such as the one we're on today, Zoom, Skype, FaceTime. I will add that a lot of these have not previously been considered HIPAA compliant. I like to give the example of FaceTime with the Apple product. In the past, it was HIPAA compliant, but since then, Apple has not signed a BAA with the Office of Civil Rights at the federal level, so it's technically not HIPAA compliant. But the feds have given the states guidance that they are waiving enforcement of HIPAA during this time as it relates to those mobile technologies. So essentially, whatever mobile platform your clients have, you can use that in order to deliver service by telehealth. There are also some options and codes that we've opened up for telephonic services for our various providers. For this provider group, the ones to note would be our telephonic evaluation and management codes that can be provided by physicians and paraprofessionals. There's two different codes, and we can provide those in our written Q&A after this call with the parameters around billing those. Now, the thing about the telephonic codes, where a doctor provides a service over telephone, is that those are reserved for established clients only. If you're doing an intake or a new patient visit, that needs to be done by telehealth, the two-way interactive audio-visual. We've also made important decisions around member eligibility, and some of that is tied to the relief efforts that that have been coming to the states from the federal government. The first of which was the Families First Coronavirus Response Act, which gives the state Medicaid agency an enhanced FMAP to help accommodate and pay for some of the additional services that we expect to see as a result of currently, that FMAP enhancement is at 6.2%, in addition to the regular FMAP that we would receive on our Title 19 populations. One of the stipulations, though, in the states pulling down that enhanced FMAP is that we cannot make any member eligibility terminations during the emergency period. So if someone was coming up for their annual renewal and they no longer met income requirements where we would normally unenroll them, we will not be doing that during the emergency period. This started on March the 18th and will go through the end of the month that the emergency exists. And so we want to let you know that, because if you run into a situation with a client who has lost eligibility after March 18th, please reach out to our member services department and we will get them fixed on a case-by-case basis. We are taking steps internally and have implemented a lot of systems changes to make sure we've done our best to make sure this doesn't happen, but we understand there's always going to be individual cases that we may miss, and we want to make sure that they get their coverage back. trying to think, I'm looking on, we are getting updates from CMS daily, sometimes hourly with new information. So as we get that, we are updating our telehealth codes, we're updating our flexibilities, specific to our tribal partners and providers, and what triggers your encounter rate. We have looked at federal regulations and current state plan authorities. And as you know, the encounter requires it to trigger that OMB rate. And so if you're providing a service by telehealth, that is considered a face-to-face visit and will thereby trigger your encounter rate. We did ask for flexibilities in our 1135, but have not received specific guidance on it from CMS directly to us around the ability to pay you fee for service for those telephonic services provided by your facilities. We know with the guidance we've seen, a telephone service won't trigger the PPS rate, but we are working on paying you fee for service for that. Although we didn't get specific guidance in response to our 1135, just this morning we did see guidance that came from CMS as a general blanket waiver and guidance to states that we can pay fee for service to our tribal partners, our federally qualified health centers, and our rural health centers. And so we will make sure our system is set up so that you can bill those telephonic codes and receive reimbursement through fee for service. All right, I think that's the main highlights. So I will also say that all of the information we're going over today, we are recording this webinar, and we are downloading all the questions and answers from today's session, and we'll also go back to staff and answer the ones that weren't answered live and then post those to our website. Our COVID website for all things related is okhca.org/COVID-19. At the bottom of that page is where we've identified our links to all of our provider webinars. Mel and I have been doing these daily at lunch, sometimes twice a day. So there's lots of good information out there, as well as questions and answers posted from our other sessions for like the therapy providers, behavioral health providers, physicians, hospitals. FQHCs is today after this session. We're also doing a dental session Monday, and we are adding a durable medical equipment and supplies webinar either Monday or Tuesday. So we also have added a web alerts function to that page. So if you go to the top, click the web alerts button, put your email information in, you will get an update anytime we add information to that page. So you can go check it out after we've added it up. Okay, we have a question. Let's see, will preventive E&M codes be included in the payable telehealth codes? So yes, for any evaluation and management code that you would bill now, if it's done by interactive two-way audio visual, it will be payable, and that will trigger your encounter rate. We're getting some more questions, but before that, I wanted to allow Dana to say a few words or greet everyone and say a few words from our Tribal Government Relations Division.
Thanks, Trailer. Hi, everyone. I'm glad to see we have quite a few attendees. Looks like we have 89. That's a pretty good turnout. So thanks everyone for calling in today. And I also want to thank Trailer and Melody for their efforts in getting information out. Previously, Johnny had sent out a link to the COVID-19 National Emergency webpage that we have on our main website. And so that's a good thing to kind of have as a favorite in your browser. Definitely sign up for the web alerts. Talking to Trailer and just different folks, things are changing almost on a daily basis, and things are happening quickly. So it's good to keep informed. So I think that's all I have, Trailer. Just thank you to everyone for all that you do for Sooner Care and for our Sooner Care members, especially during this time of national emergency. We definitely appreciate all of our providers and our tribal partners.
Thank you, Dana. And that brings me up. Dana and I were having a conversation the other day about some questions that had come up, and that just made me remember those. We have put out a couple of globals. I've been getting questions specifically around the behavioral health global. As you know, we share the Medicaid responsibility for the behavioral health program with the Department of Mental Health and Substance Abuse Services. And so we've been working with them to open those codes. It's my understanding that some of our tribal partners have also utilized the flexibilities we've given to behavioral health providers and have provided telephonic services using a GT modifier for those behavioral health services that you're providing. So I wanted to reiterate that the same would apply for anything done by telephone. Would not trigger your OMB rate at this time, but we would figure out a way for that to be a bill fee for service. And so if you, we've worked diligently to make sure our system is set up to accommodate all of these changes. But as always, if you run into a billing issue, please let us know and reach out to Dana's group or member services, and we'll do our best to get it fixed. So our PT, OT, ST telehealth visits with Zoom for tribal and Indian health services covered. Yes, so Dana, that's currently a covered service for our tribal partners, right? In a face-to-face?
Yes, correct.
Yes.
And actually, I just typed in trailer that I had one more thing to add, and that was exactly what I was going to mention, that especially Chickasaw Nation comes to mind first, with they have virtual visits over an application. I don't know if it's exactly Zoom, but they have those, and they have been for quite a while, and that it qualifies as an encounter, and they've been billing that.
Okay, perfect. Yeah, so anything you would normally bill with your encounter rate, and as if they were in person, and if you're doing that over audio visual, that will be the same as in person. We'll need you to add the GT modifier to your claim so that we can track that utilization, and that's how we process claims done by telehealth. The only difference here is that if it's done by telephone, there's only certain codes that are open by telephonic. For example, the evaluation and management codes we've opened, as well as our behavioral health codes. But telephonic services will be done by reimbursed by fee for service. And Dana or Latrita, have we heard any other questions from our partners that have come in and means outside of the webinar that we might want to address here?
The only one I can think of is that you already addressed was the telephone visits, that they don't qualify as OMB. And actually, I can't remember who asked it, but we did have some back and forth, some questions on those, and those got answered individually. But I'm glad we're addressing it today for the larger group, just to be clear.
And I'm sure most of you already are aware of our global updates, but that's where we're posting all of our frequent our updates to codes, our changes to reimbursement is through our global updates to providers. And so if you go to our regular website, okhca.org, under the provider window, there's an update link. Go to that, and there's an option for globals. So anytime we're adding something to telehealth that wasn't previously covered, we're adding it there. One that we added within the last 2 days was dental. Prior to that, we weren't covering dental by telehealth, but we are opening one limited evaluation code. And so there's instructions on how to build that. Again, that's by 2A audio visual, but we will cover limited dental benefits in order to do a limited exam by telehealth as well. And updates that we're actually getting based on provider feedback through these webinars, which has been super helpful. But we learned yesterday that we hadn't yet opened up codes for well child visits, and so we have opened those. So well child visits can be provided by telehealth for children over the age of 2. We've also begun covering physical and occupational therapy evaluations by telehealth as a response to our provider feedback in these webinars. Okay, there's a comment. We generally build a rev code, and our CPT codes and modifiers are not included on the claims. Okay, I want to say, Dana, did we provide guidance around GT at all with rev codes for OMB or no?
No, we haven't. And actually, I think Sandra is referring to their previous and current telemedicine claims. And so on those, the previous instruction years ago was to add that modifier, but I think that was changed. and they no longer do that for their telemedicine claims.
Okay. Then I would say follow whatever you're currently doing for telehealth. Follow that process. I don't want to make it more difficult or confusing. The well child checks are only billable for children 2 and over. Is that what I heard? Yes. So only by telehealth. So we are in the process of creating a global message and putting it out and making sure the system is set up for this, but we will allow well child checks for children 2 and over or over 2 by telehealth. All right, we'll give it a second to see if any more questions come in. Let's see, so do I understand correctly, for telephone services, we do not use a modifier? So for telephone services, we have specific codes that we will get you that are used for evaluation and management services by a physician and other practitioners. So you don't have to use a modifier with those because the descriptor in the code is actually for a telephone service. So you won't have to use a modifier for that. So there's a question around the different terms that we're using. So you may hear us say telemedicine, telehealth, telephonic. Just to clarify, we've gone from the term telemedicine to more all-inclusive telehealth. Our definitions of telehealth will include anything that is audio and visual interactive between the provider and the customer, and it's considered face-to-face, because just like you're seeing me now, we're talking and you can see me on the other end. Telephonic is, as it sounds, it's a telephone. So the doctor calls me, I tell them my symptoms, they're not able to do a visual inspection or a physical, if you will, because we're on the telephone. So telephonic is just over the phone. Telehealth and telemedicine are interchangeable, and that's our interactive two-way audio video. So we also want to take a moment just to say thank you to our providers. We know that it's tough for everyone during this emergency, but especially for our folks that are in the front lines and working with individuals and keeping the trains on the track and keeping operations going. And we're just super thankful that you continue to serve our members and your members during this time. Essentially, we want to be able to offer whatever flexibilities we can to get everyone through this crisis. Our main focus is for you to have whatever you need in order to continue to take care of your customers and our members. And in turn, us at the Healthcare Authority, we will do everything in our power we can to make sure that you're taken care of for taking care of them. I haven't seen any questions come in the last couple of minutes, so I'll kick it back over to Mel and have some final closing thoughts.
Okay, yeah, just to reiterate, I guess my first observation is kudos to Dana and her team, because the questions were very few today compared to our other group. So connection between tribal government relations and our tribal partners seem to be very robust and working quite well. But again, to thank all of you for everything you're doing for our members, whether it's during this crisis or before, and obviously after. And we will do everything we can to make sure that we are afforded every flexibility for your tribal citizens that the federal government will allow us to pursue. So if you hear of something, you might let us make sure that we know about it as well, so we can take advantage of it during this time. But thank you so much for attending today. And if you would like another one in the future, just reach out to Dana and we'll be happy to do it again.